Takotsubo Cardiomyopathy, also known as Stress-Induced Cardiomyopathy, is a sudden but usually reversible form of heart failure that is typically triggered by intense emotional or physical stress. Normal heart. To understand this better, let's first look at normal heart functions. In a healthy heart, the left ventricle contracts evenly and forcefully, pushing oxygen-rich blood through the aorta and delivering it to the rest of the body. As highlighted here, Takotsubo cardiomyopathy is usually triggered by sudden stress such as emotional shock, severe illness, trauma, or major surgery. This stress activates the body's sympathetic response. Catecholamine surge. This sympathetic activation leads to a sudden release of stress hormones called catecholamines, mainly epinephrine and norepinephrine. High levels of these hormones can temporarily stun the heart muscle, affecting how it contracts. It mainly affects the apex of the left ventricle, which is the bottom portion of the chamber. The apex becomes weak because of this difference in contraction. During systole, the base squeezes normally, but the apex balloons outwards. This produces the characteristic apical ballooning pattern, which resembles the Takotsubo octopus trap and stops contracting properly, while the base of the ventricle continues to contract normally. As written here, the condition is named after a Japanese octopus trap called a Takotsubo, which has a round base and a narrow neck. Clinically, patients often present with chest pain and shortness of breath, symptoms that closely mimic a myocardial infarction. ECG changes and elevated troponin levels can look very similar to myocardial infarction. However, when coronary angiography is performed, there is usually no significant blockage in the coronary arteries. Imaging such as echocardiography or ventriculography demonstrates the classical apical ballooning of the left ventricle. Management is mainly supportive, similar to treatment of heart failure. Common medications include beta blockers like carvedilol and metoprolol, and ACE inhibitors, for example enalapril, ramipril, and losartan. Unlike most cardiomyopathies, Takotsubo cardiomyopathy is usually reversible, and heart function often returns to normal within a few weeks. If you want a quick revision, you can download the high-yield notes from the description below.